Well, lower risk MDS is still a challenge because there are no treatment options that can cure disease, and that is also the case for high risk MDS. But in such patients, the aim of treatment is to improve cytopenias, therefore improving quality of life and reducing the risk of complications. But an ideal treatment should also consider survival. What is available today in Europe is transfusions. Most patients will require transfusions, and therefore iron chelation is warranted to reduce complications due to iron overload. Some patients will be able to receive erythropoietin, Epoetin alfa, which has been approved recently by EMA and is still pending approval at a country level. But Epoetin alfa seems to be quite convenient for patients that are less transfusion dependent, requiring less transfusions or no transfusions, and with serum EPO levels that are less than 200. In such patients, we can expect a response rate of about 50%. Then another drug that has been on the market and is available for lower risk myelodysplastic syndromes is Lenalidomide, and it's indicated for transfusion-dependent MDS with isolated del(5q). In these patients, about 60% of patients will be transfusion-free, but some patients will actually have the normalization of hemoglobin levels, so can actually live almost a normal life. And quality of life improves, and also there's a survival advantage. So it's a very nice drug for these patients. However, there are still unmet needs for patients that have not responded to such treatment, and they still have transfusion dependence as a burden in their daily life. Further, there are other patients that will have severe cytopenias, and there are no drugs available on the market for severe cytopenias. So a promising drug is Luspatercept, which is being evaluated now in a randomized trial versus placebo. For patients with ring sideroblasts, it seems to have a good efficacy in such patients, so that about 40% of these patients do become transfusion-free. Another promising drug is Eltrombopag for patients with severe thrombocytopenia and low-risk MDS. There's about a 50% response rate on platelets and a reduction in bleeding events, and the interim analysis of this clinical trial evaluating Eltrombopag versus placebo has been recently published in Lancet Haematology. It's a drug that can also have some adverse events, mostly nausea and vomiting, but is quite manageable in such patients that are at high risk of bleeding and death due to severe thrombocytopenia.